It's a sensitive topic, isn't it? Something many men experience as they get a bit older, perhaps a bit of frustration, maybe even a sense of loss. You might notice things aren't quite working the way they used to, those spontaneous moments are fewer, or maybe gone altogether. There can be embarrassment, a feeling of letting yourself or your partner down, and it's easy to just sweep it under the rug, hoping it will fix itself or isn't a big deal. But sometimes, these changes aren't just about sex. They can be your body trying to tell you something important about your overall health. Urologists, the doctors who specialize in men's health below the belt, see this every day, and they stress that ignoring early warning signs isn't the right path. These aren't just minor inconveniences. They can be signals pointing to potentially serious health issues that need attention. In this video, we're going to talk about 3 specific early signs of erectile dysfunction that a urologist would say you should absolutely never ignore because they could be linked to bigger health concerns you might not even know about. We'll delve into what these signs are, what they might mean for your health beyond the bedroom, and some things you can think about or even do. Make sure you watch all the way to the end, because there's something we'll cover that might genuinely surprise you and give you a new perspective on this whole topic. Let's start with the very first sign that urologists often point to, and it's one that many men might dismiss or try to rationalize away. It's not necessarily the complete inability to achieve an erection every single time. Often, the earliest signal is a change in the quality or reliability of erections. Think about it. Maybe you can still get an erection sometimes, but it's not as firm as it used to be. Or perhaps you find that while you can get one, it doesn't last long enough for satisfying sexual activity. Another common presentation of this early sign is inconsistency. One time, things might seem okay, the next time, they are not, leaving you feeling unsure and perhaps avoiding intimacy out of worry. This inconsistency, this wavering ability, is a key early indicator. Now, why is this specific sign so important, and why should you pay attention to this change in quality or reliability? Well, achieving and maintaining an erection requires a very complex interplay of systems in your body. It involves your brain sending signals, your nerves transmitting those signals, your hormones being at the right levels, and most importantly, healthy blood flow to the penis. If any part of this intricate process isn't working optimally, you get that change in quality or reliability. And often, the most common culprit behind these early changes is related to your vascular health. That's the health of your blood vessels. Erectile dysfunction, especially when it starts with these changes in firmness and consistency, can be one of the very first outward signs of cardiovascular disease. Yes, the same conditions that can lead to heart attacks and strokes. Think of the blood vessels in the penis as early warning sensors for the blood vessels in the rest of your body, including those supplying your heart and brain. The arteries in the penis are quite small and narrow compared to other major arteries. Because they are smaller, they are often the first to show signs of damage from things like plaque buildup, high blood pressure, or high cholesterol. If these tiny vessels are starting to stiffen or narrow, it means the larger vessels throughout your body are likely also experiencing the same issues, perhaps just at an earlier stage. So, that less firm or less reliable erection isn't just a problem in the bedroom. It's potentially a signal that your plumbing system, your entire circulatory system, might not be as healthy as it should be. It's a crucial piece of information your body is giving you. When you notice this change, it's not a time for panic, but for proactive steps. This sign should prompt you to think about your overall lifestyle and health. Are you eating a diet high in saturated fats and processed foods? Are you getting enough physical activity? Is your weight in a healthy range? Are you managing stress effectively? Do you smoke? Smoking is particularly damaging to blood vessels. All these factors significantly impact your vascular health. For example, shifting towards a more Mediterranean-style diet, rich in fruits, vegetables, whole grains, lean proteins like fish and chicken, and healthy fats from olive oil and nuts, can make a remarkable difference in vascular health. This kind of diet helps reduce inflammation, lower cholesterol, and improve blood vessel function. It's not about deprivation, but about making sustainable, enjoyable choices. Regular physical activity is another powerful tool. Even moderate activities like brisk walking for 30 minutes most days of the week can significantly improve blood flow and cardiovascular health. Exercise helps lower blood pressure, improve cholesterol levels, and maintain a healthy weight, all of which directly benefit the health of your blood vessels everywhere, including those crucial for erections. It's like giving your circulatory system a workout, making it stronger and more efficient. Don't feel you need to run a marathon. Simple things like taking the stairs instead of the elevator, parking a little further away, or going for a walk after dinner can add up. Finding an activity you enjoy, whether it's gardening, swimming, dancing, or cycling, makes it much easier to stick with. Consistency is key here. Managing stress is also vital. Chronic stress can impact hormone levels and blood pressure, both of which can affect erectile function and overall cardiovascular health. Finding healthy ways to cope with stress, such as mindfulness meditation, yoga, spending time in nature, or pursuing hobbies, can have a positive ripple effect on your physical health. And if you smoke, seeking help to quit is perhaps one of the single best things you can do for your vascular health and, consequently, for addressing this early sign of ED. Quitting smoking can start to improve blood vessel function relatively quickly. So when you notice that erections aren't as firm or reliable as they used to be, see it not as a failure, but as an important message from your body. It's a cue to check in with your doctor, get some basic health numbers tested, blood pressure, cholesterol, blood sugar, and to seriously consider making some positive changes to your lifestyle. Addressing these underlying vascular issues can not only help improve erectile function, but more importantly, can significantly reduce your risk of much more serious cardiovascular events down the line. It's about looking at the bigger picture of your health. Now that we've discussed the importance of changes in erection quality and reliability as a potential vascular health signal, let's move on to the second early sign that urologists advise you never to ignore. Now, the second crucial early sign that a urologist would urge you not to overlook is changes in morning erections, or the complete absence of them. For most healthy men, it's normal to experience spontaneous erections during sleep, particularly during REM sleep cycles. Many men wake up with an erection, often called morning wood. The presence of morning erections is a good indicator that your body is physically capable of having erections, that the nerves, hormones, and most importantly, the blood supply to the penis are functioning correctly. If you used to have regular morning erections and they have become less frequent, less firm, or have disappeared entirely, this is a significant signal. It's different from difficulty getting an erection during sexual activity, which can sometimes have psychological components. Morning erections are involuntary. They happen when your body is relaxed and not consciously trying to perform. Therefore, their absence is often a strong indicator of a physical issue rather than a purely psychological one. What could the disappearance or significant decrease in morning erections indicate? Again, vascular health is a primary concern, just as with the first sign we discussed. If blood flow isn't sufficient or the blood vessels are compromised, these involuntary erections might stop happening. It reinforces the potential for underlying cardiovascular issues. However, the absence of morning erections can also point towards other important health problems. One significant area is hormonal health, specifically low testosterone. Testosterone plays a role in sexual desire, but it also influences the quality and frequency of erections. As men age, testosterone levels can naturally decline, but sometimes the drop is more significant than average, leading to symptoms like decreased libido, fatigue, mood changes, and yes, reduced or absent morning erections. Low testosterone can also be linked to other health conditions like weight gain, particularly around the abdomen, and loss of muscle mass, which further impacts overall health and vascular function. Another potential link for the absence of morning erections is neurological issues. The brain and nervous system play a critical role in initiating and controlling erections. Conditions that affect nerve function, such as diabetes, multiple sclerosis, or even prostate surgery, can impact these signals. While this might be less common as an early sign compared to vascular or hormonal issues, it's still a possibility that shouldn't be dismissed, especially if accompanied by other symptoms like changes in sensation or urinary problems. Considering the potential link to hormonal issues like low testosterone, what kind of practical steps or habits can be helpful here? Firstly, If you notice the absence of morning erections, alongside symptoms like unusual fatigue, weight gain, or decreased interest in sex, it's definitely worth discussing with your doctor and potentially getting your hormone levels checked. If low testosterone is confirmed, there are medical treatments available, but lifestyle adjustments can also play a significant role. Maintaining a healthy weight is crucial, as excess body fat, especially belly fat, can interfere with testosterone production. Engaging in strength training exercises can help boost testosterone levels naturally and improve overall body composition. Getting enough quality sleep is also incredibly important, as testosterone is produced while you sleep. Aiming for 7 to 9 hours of uninterrupted sleep per night can make a difference. Nutritionally, a balanced diet supports hormone production. Ensuring you're getting enough healthy fats, zinc, and vitamin D can be beneficial. Foods like fatty fish, nuts, seeds, lean meats, and plenty of vegetables contribute to overall hormonal balance and health. It's not about miracle foods, but consistent, healthy eating patterns. For both vascular and potential neurological links, managing conditions like diabetes and high blood pressure is absolutely paramount. If you have diabetes, keeping your blood sugar under tight control is essential for protecting your nerves and blood vessels. High blood pressure management through diet, exercise, and medication if necessary is vital for preserving vascular health. Regular checkups with your doctor to monitor these conditions are not just recommended, they are non-negotiable when you're seeing these kinds of early signs. They can help identify problems before they become severe and manage existing conditions effectively. So, the disappearance or reduction of morning erections is a key indicator that something physical is likely affecting your erectile function. It strongly suggests a need to investigate potential issues with your vascular health, hormonal balance, like testosterone levels, and possibly neurological function. It's a sign your body is giving you when you're not even thinking about sex, highlighting an underlying physiological issue that needs attention. Taking this sign seriously and seeking medical advice allows for timely diagnosis and management of whatever might be causing it, which can have benefits extending far beyond just improving erectile function. It's about safeguarding your overall health and vitality as you age. Next, we will look at the third early sign that urologists emphasize needs your attention, and it's one that many men might feel is too trivial to even mention to a doctor. The third early sign of erectile dysfunction that urologists want you to pay attention to, and perhaps the one most easily dismissed, is a change in the time it takes to achieve an erection, or the amount of stimulation required. Maybe you used to be able to become aroused and get an erection quite quickly with minimal physical or mental stimulation. Now, you find it takes much longer, requires more intense physical touch, or perhaps a greater degree of mental focus than it used to. This isn't about losing spontaneity entirely overnight, but noticing a gradual shift where it just seems harder, slower, and requires more effort to get things going and keep them going. This increased need for stimulation is often an early signal of changes in blood flow or nerve response that are not yet severe enough to cause complete inability, but are definitely impacting the ease and speed of achieving an erection. Why is this slower response time important? Like the other signs, it often ties back to your vascular health. Achieving an erection is dependent on rapid and sufficient blood flow into the penis, trapped there to create rigidity. If the blood vessels are not dilating as effectively, or if there's some degree of plaque buildup affecting flow, it will naturally take longer for enough blood to enter the penis to achieve firmness. The vessels might be less responsive, requiring more persistent or intense signals, stimulation, to open up. This sign can be particularly subtle and easy to attribute to just getting older or being tired. While age is a factor in many bodily processes, a noticeable change or difficulty is not just a normal part of aging that you have to accept. It's a potential symptom of something that can often be improved or managed. Beyond vascular issues, this sign can also sometimes be related to nerve function, although reduced blood flow is usually the primary physical driver. If nerve signals are slightly delayed or weaker, it can impact the speed at which the message to engorge with blood is received and acted upon by the penile tissues. Again, conditions like diabetes are relevant here, as they can affect both blood vessels and nerves over time. Furthermore, this sign can sometimes be intertwined with psychological factors, but it's crucial not to assume it's purely psychological without ruling out physical causes first. Performance anxiety can certainly make it harder to achieve an erection, creating a vicious cycle. However, if a physical issue like reduced blood flow is making it physically take longer, the frustration and worry about that can then add a psychological layer, making it even harder. That's why identifying the initial physical difficulty is so important. It allows you to address the root cause rather than just trying to manage the resulting anxiety. What kind of lifestyle factors or habits relate to this slower response time? Everything we discussed regarding vascular health for the first sign is highly relevant here. Diet, exercise, weight management, smoking cessation, and managing conditions like high blood pressure and cholesterol. Improving blood flow through these means is key to potentially restoring a more efficient erectile response. Consider incorporating foods and activities known to support nitric oxide production. Nitric oxide is a molecule that helps blood vessels relax and dilate, which is essential for blood flow to the penis. Foods rich in nitrates like leafy greens, spinach, kale, arugula, and beets can be beneficial. L-arginine, an amino acid found in foods like nuts, seeds, red meat, poultry, and fish, is a precursor to nitric oxide. While supplements are available, getting these nutrients from a balanced diet is generally recommended and more sustainable. Regular exercise also stimulates nitric oxide production, contributing to better blood vessel health and function. Pelvic floor exercises, often known as Kegel exercises, aren't just for women or prostate health. Strengthening the pelvic floor muscles can improve blood flow and nerve function in the pelvic region, which can potentially help with both erectile function and control. These exercises are simple and can be done anywhere, involving squeezing and holding the muscles you use to stop urination. Doing sets of these daily can contribute to better function over time. It's also worth considering sleep hygiene. Poor sleep affects hormone levels, stress levels, and overall bodily repair processes, all of which can impact erectile function and the responsiveness of your body. Prioritizing consistent, restful sleep is a simple yet powerful habit that supports overall health, including sexual health. Perhaps one of the most surprising aspects related to this sign, and one I hinted at earlier, is the connection between gum disease and erectile dysfunction. While it might seem unrelated, studies have shown a link between chronic gum disease, periodontitis, and ED. The theory is that the inflammation and bacteria associated with gum disease can enter the bloodstream, causing systemic inflammation and potentially damaging blood vessels, including those important for erections. Maintaining good oral hygiene, brushing and flossing regularly, and seeing your dentist isn't just about your teeth. It might also play a small but potentially significant role in your vascular health and erectile function. This is one of those connections that highlights how interconnected your body's systems truly are. So, if you're noticing it takes longer or requires more effort and stimulation to get an erection, don't just brush it off as age. See it as an important signal to evaluate your lifestyle, particularly habits related to vascular health. Consider potential underlying conditions, and perhaps even pay extra attention to your dental hygiene. It's a nudge to look after your body from head to toe. Taking a moment to recap the 3 early signs urologists emphasize: changes in the quality or reliability of erections, less firm, inconsistent, the disappearance or significant decrease in morning erections, and changes in the time and stimulation required to achieve an erection. None of these should be viewed in isolation or simply as inevitable consequences of getting older. Instead, they are valuable signals your body provides, often pointing towards underlying health conditions, most commonly related to cardiovascular health, but also potentially hormonal or neurological issues. Recognizing these signs isn't about dwelling on a problem, it's about empowerment. It's about having the information you need to take proactive steps for your overall health and well-being. Thinking about your diet, incorporating regular physical activity, managing stress, prioritizing sleep, avoiding smoking, and ensuring you're getting regular health checkups. These aren't just generic health recommendations. They are concrete actions that can directly impact the health of your blood vessels, nerves, and hormones, which in turn can improve or maintain erectile function and, far more importantly, protect you from more serious health issues like heart disease, stroke, and diabetes complications. Remember the surprising link between gum health and ED2. It shows how seemingly small habits can matter. It's essential to speak with a doctor or a urologist if you are experiencing any of these signs. They can conduct a thorough evaluation, which might involve checking your blood pressure, cholesterol, blood sugar, and hormone levels, and discuss your lifestyle and medical history. This isn't about feeling embarrassed. It's about seeking professional guidance to understand what's happening and create a plan. There are many effective treatments available for erectile dysfunction itself, but discovering and addressing the underlying causes is the most crucial step for your long-term health. Remember, making small, consistent changes can lead to significant improvements over time. You don't have to overhaul your entire life overnight. Start with 1 or 2 habits, perhaps adding a 20-minute walk to your daily routine, or swapping out sugary drinks for water, or committing to an earlier bedtime. Every positive step counts and builds momentum. Your health is your greatest asset, and paying attention to these early signals is an act of self-care. It's about ensuring you can continue to live a full, active, and vibrant life, enjoying intimacy and everything else you value. Don't ignore these important messages from your body. Listen to them and take action. It's never too late to make positive changes. I truly hope this information has been helpful and provided some clarity on these early signs that urologists recommend never ignoring. If you found this video valuable, please consider giving it a thumbs up. It helps more people see this important information. And if you have any thoughts, experiences, or questions you'd like to share, please leave a comment below. Connecting and sharing helps us all learn from each other. Also, don't forget to subscribe to the channel if you haven't already, so you don't miss out on future videos aimed at helping you live your best life at every age. Thank you for watching and taking charge of your health journey. Live your best life at every age.